East Cooper knows vascular health, and this morning they are sharing some life-saving information you don't want to miss. Here with more is Dr. Michael Edwards. Doctor, how are you?
Good, how are you?
It's good to have you here.
I'm glad
So we're
to be here.
talking about something also known as PAD, but it's peripheral artery disease, right?
Yes.
Okay, just give me a little bit more information for those of us out there that don't know. What is it?
What it is it's a reflection of compromised blood flow to an extremity.
Okay, that said, what would that mean to a person like me that has no idea what PAD is or how it can happen to me?
Patients usually present with symptoms that limit their lifestyle. They present with problems with their legs, pain in their legs, pain with walking, which is relieved with rest.
Do you see this in all different ages, or is it usually 50 and over, or how does that work?
It's usually 50 and over. It's most commonly associated with diabetes, high cholesterol, sedentary lifestyle.
Okay, so let's say you've gone ahead and you've diagnosed someone and they do know that they have PAD. What's the next step? What are maybe some treatment options that they have?
The most important treatment option to start with is modifying some of their risk factors, controlling their diabetes, increasing their exercise tolerance, and seeing an appropriate physician.
Wow, okay, well I think that we have an animation here that we want to show everybody, our viewers out there, so that they can watch this as well. But what are we seeing, doctor?
Here you're seeing an arteriogram where we injected dye into the artery in the legs. Patient presented with claudication or cramping in her thigh and buttocks. And the arteriogram showed that she had blockages in the blood vessels in the aorta and iliacs, and she subsequently underwent a stent placement to improve those the blood vessel flow to the buttocks.
And I imagine that these procedures that you perform are life-saving and life-changing. Because if you always have these leg pains, you can't do regular activities.
That's correct.
Wow.
It improves their lifestyle. They're able to get out and walk to improve their cardiovascular health. The recovery time for the endovascular procedures is much shorter than the open procedures that we do. The recovery time is usually in the period of days.
Okay.
It's usually done as an outpatient or at least with an overnight stay, and they're back to work within 2 or 3 days.
And East Cooper has a beautiful new facility over in Mount Pleasant, and you're performing these procedures at that facility as well now, correct?
Yes, we are. East Cooper opened up the new hospital approximately 2 years ago. We started doing the procedures then, and it's changed the people coming from over to the hospital in the East Cooper area.
I imagine. Well, let's say someone out there right now is watching and they're saying, that might be me, but I'm not really sure. What would you suggest? Maybe them getting a consultation with you and trying to get some things figured out?
They should talk to their primary care physician, and if he or she thinks that they should see a vascular surgeon, then they should certainly call us.
Yeah, and these are ABC News 4. They're experts, they're specialists, so they know exactly what they're talking about. Don't think that, a lot of times people go at home and they think, I'm going to get online and Google this and see what I have. And then it really could end up changing your life if you don't get this taken care of.
That's correct.
What are some of the maybe, I wouldn't say side effects, but let's say this goes untreated. What could happen?
If it goes untreated, then it can certainly progress into the point where they would lose their limb, lose their toes, have a non-healing ulcer on their foot or on their leg,
Wow.
Which will create more problems.
You can't imagine, and you would never want it to go that far, so just go ahead and get it checked out.
It's much easier to take care of it early.
Yeah. What are just maybe a couple of the side effects that somebody might experience after they get these treatments?
The side effects are really very minimal. You can have
Wonderful.
We have problems with the needle puncture where we stick the groin, developing a hematoma. Very rarely they'll get anything that would last longer than a couple of weeks.
Right. Well, and the reason I bring that up is because with any procedure, there's a chance for side effects. But the good news is with what you're doing, it's minimally invasive.
That's
so
correct.
Usually nothing much happens, but you get back to your regular life.
That's what we like.
Yeah. And there again, just want to remind you that This gentleman right here is one of our ABC News 4 experts, and all you have to do is go to that website right there. You can get more information on everything that we talked about today on PAD and some other experts there as well. So we really appreciate you being here, good doctor. Thank you so much.
All right, thank you.
We'll let you get back to your busy schedule saving lives.
All right, thank you.
Well, Dorchester Habitat for Humanity is building for a cause, and they need your help. Details coming up right after this break. Stay with us.